Asian double eyelid surgery. What type of procedure should I get? Can I get fillers for the hollowness at my eye socket? I was born with double eyelids. I am now 50 and my eyelid has drooped, making my double eyelid almost non-existent. In the second photo, my eyes are semi-closed and you can see where the line is. However, with my eyes fully opened in the first photo, my double eyelid is not visible at all. What procedures do I need to fix this? In the photos, you can also see the hollowness at my eye socket. Could I get fillers there? This is my first time asking for advice, so I appreciate your time and help.
Thank you for your question. You're 50 years old and you articulated in your question that you were born with double eyelids, but now your eyelids have drooped and you've asked a series of questions regarding hollowness and filler and what would be a strategy for you. Well, reviewing those photos, I can certainly tell you one thing that appears to be clear to me about your eyelids, and that is that you do appear to have something called ptosis. Ptosis means drooping, and when we talk about eyelids that are drooped, we call it eyelid ptosis. So what does ptosis mean? Well, typically when someone has a drooping eyelid as they get older, as long as there are no other neurologic basis for the ptosis, it's typically something called levator aponeurosis ptosis or levator muscle attenuation, involutional ptosis. They used to be called senile ptosis, but the terminology changed to involutional. Basically means that the muscle that is responsible for lifting the eyelid becomes thinner and eventually it stretches and the eyelid level and height droops down. So you could imagine if you have some kind of traditional cosmetic surgery, whether it's blepharoplasty or any other surgery to enhance the appearance of the eyes, if the ptosis isn't addressed, then it's not likely you're going to have much of a significant improvement, because if the eyelids are low, it's not, you're still going to be looking like you're tired. So I would probably suggest doing the ptosis procedure first before you address the relative hollowness of your upper eyelids. So the ptosis surgery, I'll let you know what we do in our practice. When we do ptosis surgery, we do this in our office, in our Joint Commission operating facilities, and we do the surgery with the patient under local anesthesia with light sedation. And the ptosis is actually a relatively, deceptively complex procedure. It's a muscle that's very, very sensitive. And so what we actually do is we actually have the patient open and close their eyes while they're laying down, and we'll even sit up the patient. Now the patient never feels any pain and is perfectly fine and comfortable, but we're actually able to then try to adjust the height and shape and contour to try to make sure that you get the correction and the symmetry. It's something that we find that more than 95% of our patients get a really nice result. Some people still need to come back for some type of revision, whether it's the eyelid too low or too high. So that's something to learn if this is the first time you've been told that you have ptosis. The other thing as far as the hollowing is concerned, now this is very common when we think about Asian eyelid aging. You can have very full eyelids when you're young, and in a way it's almost comparable to the way there's volume loss in the breast. What happens in the breast is that you get something called upper pole deflation. You lose the fat and volume in the upper pole of the breast and it diminishes. Well, a similar thing happens to the upper eyelid. It actually also happens in the mid-face. The little cheek areas, the submalar space, the volume diminishes and the face gets flatter. In the upper eyelid, in a lot of Asian patients who had very full upper eyelids when they were young, they become relatively hollowed. So usually my advice is not to be too aggressive about restoring volume in the upper eyelid. And this also applies to Caucasians or people who used to have very full upper eyelids who said that they never had much of a lid and they could barely wear makeup and that was fine. They liked that look. But as they got older, they have extra skin. And they try first to use fillers or try to get fat transfer and ends up having bagginess and excess and doesn't look very good. So it's almost like you have to embrace a new normal in order to just kind of move forward and try to add some predictability. In some patients, we've actually been very successful with using a hyaluronic acid filler to restore some volume conservatively in the sub-brow space to restore kind of a nice natural appearance that they're satisfied with. It's not the same as they had when they were younger, but it looks more like them. In other patients, we've actually used fat. But with fat, I always tell my patients it's a graft, and because anywhere from 30 to 70% of that fat can be absorbed, be prepared to do a second procedure. So in a situation like yours, I would probably address the ptosis first, allow everything to heal, then see if you're happy with just the ptosis correction. Ptosis can have a dramatic impact on the physical appearance of the eyes, and you can really look aesthetically so much better that the hollowing may not become so important to you. So in summary, consider the ptosis procedure as your first procedure, allow it to heal, then consider less invasive options such as hyaluronic acid filler and then possibly fat transfer or fat grafting to address the relative hollowing. So I hope that was helpful. I wish you the best of luck, and thank you for your question.